Thank you very much for being here for our second session, and this is the continuation of today. Luke and Ellie just spoke very well about where we are, that basically we are suffering this trauma because of the system. And the focus of this second session is a very difficult question, which is what needs to be done to address this issue, what can be done for a change. And I am going to introduce the speakers for this. We have here Peter Baker. He's a psychologist and he is from Kent University, the Tizard Centre. We also have Viv Cooper. She's a brilliant parent carer and the founder of the Challenging Behaviour Foundation in London. And we also have Mary Busk. She's also a parent carer and she works for NHS England. So the idea is that they will offer you a presentation and then we will have also a space for some questions. Thank you.
That's not really what we're going to be talking about. That's what we were asked to do, but I thought that was far too difficult. There's a number of things we've got to do. But first, just for us to get a sense of the room here, could you put your hands up if you're here as a professional? Okay, a few people. And you can have dual roles, so you can put your hands up twice. If you're a family sort of member. And lastly, those of you that got a pathological fear of putting your hands up. Okay, so we've covered the room. So it's sort of fairly sort of even split here. What we're going to talk about actually, we're going to present some sort of research findings from a project that we're going to explain. These findings, I suspect, are not going to be particularly shocking or surprising. Given the conversations that we've already had in the room today, but certainly it's not always the case. Viv and I have presented this to other groups, and we've shocked them, we've annoyed them, irritated them, and hopefully moved them into a place where perhaps they could do something about it. We're going to be challenging the view that the problem lies within families. Already, that has been the narrative of the morning. And I think we've pretty much shot that myth down. We're going to be sharing the stuff that we've got about interacting with the system causing trauma. We're going to specifically describe an awareness-raising resource that is currently sort of being offered by the Challenging Behaviour Foundation. So this will perhaps be a tool to move us on, and then finally we will do what we've been asked to do, which is the final slide that's got loads of questions over it, and it's really about setting the agenda and prompting the responses from the audience here about where do we take this? Okay, we've defined the problem, so what do we do? Okay, a bit about the starting point of this project. This was a co-produced project. We were commissioned by NHS England. The partners were the Challenging Behaviour Foundation, Respond, who are a specialist psychotherapy provider, sort of based in London, and ourselves at the Tizard Centre at the University of Kent. What we were asked to do was to have some sort of research that tried to capture family carers' experiences of trauma. We were also asked to develop a training resource, and more of that later, much more detail about that later. And also, finally, there was a pilot of a trauma therapy support service as part of this. And I think, in essence, the way we were is if you ask the wrong question, you get the wrong answers. This is often the case. But the fact that we were specifically asked to look at mending broken people rather than what do you do to stop people get broken, I think was there in the project right from the off. And I think, you know, we will return to that thing. Okay, this is what we found, and this will be of no surprise, and it will not shock most of you in this room. Experiences of family carers and children with adults with learning disability and who are autistic would appear to be multi-layered, complex, and many experience a wide range of traumatic events with the associated emotional and personal sequelae. And all of the participants, 214 family members that responded to an audit that we sent out, and this was available for only 3 days through the networks of the Challenging Behaviour Foundation. All of them were reporting at least one of the criteria that you would associate with complex PTSD. And indeed, 10% of them had actually received a formal diagnosis. So it's out there, absolutely big time. But the surprising thing, perhaps to some of us, but I guess not to you guys here, was that their experience was that the system not only failed them, but this was the cause, and this was what generated the trauma in those sort of individuals. So the respondents described the sorts of things that they were experiencing that linked into the sequelae that they were describing, and these are some of the things here. And we're going to be hearing from Mary sort of later on, a few minutes' time, about her own personal experiences. But you know, these would be that would have echoes with people in the room and what you've already said to us thus far. So the conclusions that we had in relation to this was that the trauma experienced by family carers and children of adults and children with a learning disability who are autistic would appear to be multi-layered and complex, with many experiencing a wide range of traumatic events. Overwhelmingly high percentage of family carers reported experiencing all of the symptoms of complex PTSD at least once, and it would appear that they received little to no help. Negotiating a way to a system that is meant to be in place to provide support to them, their experience was that the system not only failed to provide support, but also created additional trauma. Okay, you guys know this, and maybe now, if you're going to try to make an argument, you have this now in a peer-reviewed sort of paper, and that should hold a bit more weight than you just, you know, shouting at people saying, you know, this has got to change. So you know, that's one of the take-homes that you can have. Also, within sort of my university, somebody got wind in the Department of Impact about the project that we were doing, and they were quite excited about this, and they put some money behind us creating an audio-visual sort of a record of the research, and that's now sort of available sort of on YouTube. So it's professionally produced 12-minute sort of documentary, and we have the link to that at the end of the presentation. So that's another resource that will be available for you to take out and sort of make these arguments. Okay, before I hand over to Mary, I'm going to have a word of warning, sort of about trauma. Trauma's okay at the moment. It's vogue. You know, everywhere you go, you hear people talking about it, and this wasn't the case a few years ago, 5 years ago. You know, it wouldn't be part of the narrative. Now, an Australian psychologist, Nick Haslam, has made a comment about this, an observation. He called this phenomena sort of concept creep, and he says it's particularly the case in relation to trauma, because if we think about what's the history of trauma, well, trauma originally was conceived as a physical wound, and you still see that in general hospitals. You have trauma wards, and they're not there for people with PTSD. These are for people that with physical wounds. And then during the First World War, we began to conceptualize trauma much more broadly as having a psychological sort of impact. However, that conceptualization of trauma was in relation to one life-threatening incident, and that was how it was defined. But we know now we have a much broader conceptualization of trauma. It's not necessarily confined to one incident. That incident doesn't need to be life-threatening. It can be cumulative impact of many incidents. So this is not a criticism, it's just an observation. So what are the implications around bringing this concept into a discussion about families' experiences? Well, there are certainly positives, because I believe this shines a spotlight on the experience of families and highlights that the cause is not intrinsic and individual, i.e., people are not bad and unreasonable people, but it's because of negative experiences. So it's shifting the focus to the experiences, to the environment. And this will go some way to stopping parent-family blaming. However, there are some negatives that we need to be aware of, and that previously it's been assumed that compromise psychological well-being of families, there's huge literature about this, is caused by the reality of the child. People talked about, Simon Olshansky talked about chronic sorrow, etc., and the associated direct care demands and sacrifices required. However, if we give families a diagnostic label, there may be a tendency for people to come along and think, well, what you need is therapy. What you need is some sort of medicalization of your issues and your problem. So it would shift the focus back to you and not to the causes. So these are the dangers. So just beware of this. We can, I think, use the current popularity of people talking about trauma, I think, but eventually I think there will be a backlash. I had a conversation with Luke, and he said flippantly to me, oh, we're all traumatized. And this was I can't remember what we were talking about. I think it might have been Brexit. I don't want to give his politics away. It might have been that. And said that we're all suffer from sort of post-Brexit trauma. If that is the case, it's a problem, isn't it? When trauma becomes part of the human condition, it's a problem. I don't need to highlight why that might be. So let's just be careful.
Hi. Okay, so I'm going to talk to you more about the training resource that we developed, and I'm just mindful that there are families here in the room who helped us with that, and also families online who helped us with that. It was a sort of joint effort from everybody. So Peter's described some of the responses that were shared by family carers in our survey and how their experience of trauma their experiences are ongoing, and families who have a child with disabilities experience the same trauma that everybody experiences. We all experience trauma in our life, but for families that we consulted with, there are these additional layers on top, and they are caused by interactions with the system. So this is a quote from family care who shared her experiences in the workshop films that we co-produced. You can see that if you feel your child's in danger, but you're powerless to protect them, and the people you're talking to are not listening, not concerned, and think that the way your child is being treated is okay, you can imagine how terrifying that is, and what a challenge it is to try and stay positive, and to try to stay focused on the change that your child needs, and to keep on keeping on. And so families are being put in situations where they have no control over what's happening to their loved one, and despite all their efforts, they're powerless to make people understand. And on top of that, we have to remain calm, polite, reasonable, and persistent. And these are situations that are ongoing and repetitive. So we asked families to describe how these experiences made them feel, and here are a few examples. So family care descriptions, what it feels like to interact with a system that's meant to be there to support you. And you can see the range of emotions that the interactions cause. So there's isolation and helplessness, hopelessness. There's a sense of fighting a system that's working against you. And when you ask for help, and I think we need to acknowledge that actually it's quite hard to ask for help sometimes. And so when you've got over that sort of, well, I do need to ask for help, often the response is that you're trying to get something that you're not entitled to, or that you are responsible for the needs that you're trying to get help with. And as you can see, one quote highlights the sort of repeated failures of the system to deliver, and that breakdown of trust and how that trust is destroyed. And at CBF we support lots of families who are interacting with the system to try and get the right support in the right place at the right time. And we say that families have to be beyond reasonable in terms of how they interact and how they interact with the system. Because it's so easy to be labelled as difficult. I know Ellie said that she's been labelled as difficult. I've been labelled as difficult. Probably most of the families here have been labelled as difficult because it's really easy to label families as difficult and then to put that blame on the family. And one of the key things that came out from the study was that this sort of constant interaction and battles is relentless. It's you get over one hurdle and you have to get over another and another and another. My son is now 38 and I am still currently right at this moment going through some ongoing hurdles to ensure that the support that he has continues in a way that enables him to have a good quality of life. So the broken report conclusion was, we asked families to identify the cause of the trauma, what is causing the trauma, and they could identify it. And if they can identify it, we can do something about it. And so it's this shift from let's help families after they're traumatized to think about, well, let's stop traumatizing them in the first place. And if families are best placed to identify what needs to change, and they did come up with some solutions, and we'll come on to that in a minute. So the system at the moment is set up in a way that works for the system. So what's administratively convenient. So the system divides people's lives and needs into separate categories: children's services, adult services, education, health, social care. Each has different funding, each has a different eligibility criteria, different staff, different capability, different capacity, but real life isn't like that. So families have to manage that sort of holistic approach, and navigating through that maze of a system is time consuming and frustrating. So as part of the resource and the work that we did with families, we produced a range of workshop and films and materials, and this is a graphic that families co-produced to give an example of what it feels like, the extent of the trauma and how it ripples through families, and Ellie talked about that earlier this morning. So it affects people individually and it impacts on them and their relationships with each other. And because there are multiple experiences of trauma, it happens again and again, so rippling through. So following the family carer survey and a broken report that's on our website that sort of sets out the findings from that, which then Peter used in his journal article, and other related work, we were commissioned to work in partnership with other organisations to support the development of an awareness-raising resource to share the findings with professionals who support family carers. So the commissioners envisaged a set of PowerPoint slides that could be then delivered to by anyone to professionals. So at CBF, we reconvened the group that had helped us with the initial work, the initial survey. The survey was co-produced by families. It was tested by families before it went out. And they helped us write the report, the broken report. So we reconvened that group, family carer group, who'd worked with us on the survey, and we asked them, what do you think is needed to raise awareness amongst professionals from the findings of the report? And they said, it's not a set of PowerPoint slides. And there are a number of reasons for that, which was they were very wary of their words on a slide being delivered by someone else, and the sort of the implications and the tone and how that would be perceived. And they said very clearly, we want to say how it is directly. And so we agreed that we would produce a set of 4 films, and that would take people through a journey, and that would involve families speaking directly about their experiences. It would involve graphics that families designed, and quotes, and a whole range of things to think about how people take information and how they learn, so that it was flexible and impactful. So it took much longer than producing a set of PowerPoint slides, and we had to negotiate that because there were some people who were very fixed around it's going to be a set of PowerPoint slides. But you know, in the end, it was a much better resource, and that is co-production. That's like saying, this is the issue. Let's all think about how we want to address it. So the concept, the design, the content, the narrative, the graphics, all of those were co-produced. And the key message was that trauma experienced by families interacting with the system is predictable, and because it's predictable, it's preventable. And so that was the title of the resource. So I'm going to briefly describe the training workshop. So as I said, it's got 4 chapters, and so there are 4 short films. They take people through a narrative, and the workshop is co-facilitated. So it is co-facilitated by a family carer and a clinician, or someone who's working professionally in the field. And that's an approach that we have at the CBF in all of our training, because we're wanting to model that we are working together. This is a joint effort. We need to be able to build on each other's experiences and knowledge. This is not a blaming system, families blaming professionals. This is working together to find a way to make the system work for families, which is what it's meant to be doing. Family carer have the films in their own words, they're not interpreted. And just as part of that process, it was really interesting to see how people responded to that, because people wanted to share their experiences. They had a lot to say, but they were wary about that because of potential repercussion. So we have one family a family carer who is in the film, but is blurred out. She's blurred out because she wanted to contribute and then said, but I'm worried if some people see it and use it against me. And so that's like the level of trauma that people are experiencing and continue to experience, and the fear that they're experiencing. So the first film, chapter 1, talks about what is trauma and who experiences it. So they describe how, why, and what it happens, and what it feels like, and the extent of the trauma and its impact. The second chapter, so there's you see the film, then there's a facilitated discussion. Then you move on to the second film, which covers why there is trauma and what's causing it. So it uses graphics and family carers' experiences, and this includes how families feel they're climbing a mountain. So there's a graphic here. On the top, it's got right support, the flag's missed off. So we have this graphic to explain what actually feels like climbing a mountain. And actually, families are climbing up one side and professionals are climbing up the other, because we both want ultimately the same thing, but actually we should be climbing it together and helping each other to get up that mountain. And then another example of a graphic there, which is this sort of a family, a dad explaining what it's like when their relative is, that they're trying to, the system is trying to fit their relative into a service that doesn't meet their needs. And he talks about trying to break through a system-focused, system-centered wall to get to this sort of person-centered approach. And you know how difficult that is and how complicated that is, despite the fact that policy says person-centered support is our stated policy. So the third chapter looks at, well, why does this keep happening? and this multi-layered and ongoing trauma that people experience. And they describe this trauma cycle, again, this is another graphic. So they talk about caring for their disabled son and daughter, asking for professional help, that help not being provided, feeling dissatisfied, professionals feeling defensive, and it goes round and round and round in terms of family blame and so on. So it's a sort of downward spiral, but it doesn't have to be like that. And as we know from Luke's work, families experience institutional blame, and we've talked about that already. And it's something we come across a lot through our CBF helpline and casework. So the system doesn't see families as informed and experienced partners with a wealth of knowledge and skills to contribute. We're seen always as deficient. And at CBF, we promote valuing and investing in families in a sort of continual professional development model, which is we already have a huge amount of knowledge and skills that we want to contribute, and it's valuable to contribute. And so we should be investing in families to enhance those skills, including how to navigate through a complicated system. So my son has, he's 38 now, he's had dozens of people come in and out of his life, some of whom have been really important to him, but mostly they've come and gone. We as his family have been there forever, and we will continue to be there. So we have a wealth of knowledge and experience, and we want to contribute that, and we want to work with people together. So this is another sort of graphic that families have developed as part of the workshop training. Families experience endless pinball, and it's sort of the equivalent of in the Cerebra booklet, there's snakes and ladders. So it's a similar sort of thing, which is, you know, if you lack the expertise, if you're exhausted or distracted, or simply unlucky, your ball falls down, you have to start again. And they describe these battles with the system that feel as though they're constant and lifelong. And families don't want to fight, but you're sort of put into that position. So the workshop emphasises the need to work together with families as equal partners. And then very deliberately, in chapter 4, families wanted the 4 films to have a narrative to honestly describe their experiences and how the system causes and perpetuates trauma. But they wanted to end on a practical and positive note in terms of ways to change the system and prevent trauma. So this chapter is very much focused on, well, okay, so if this is happening now, what can we do to change it? And the message is very much, we all have a responsibility. We can all do something. It's not too big. It's not too big. We can all think, and there's some very, very practical examples that families give in this chapter. So it focuses on what the system can do that will make a huge difference and prevent the actions that cause trauma. So now I'm going to pass over to Mary.
Thanks very much. I was asked to give a personal perspective on my family's experience of trauma, because I had also spoken on the video that Peter spoke about. So I'm here today to give my family just reflections. I think these are the wrong.
No, go back.
Yeah.
Yep.
The next one. Yeah. So I think that from the very beginning, it's been a lifelong battle, I would say, of trauma. We've had to sort of fight for provision and care really from the outset. There was a sort of a game being played right from the start. So we experienced sort of late or no diagnoses. I had to give up work, as I think many family carers have to spend my whole time working out how to get the right support and diagnoses and just understanding of who my son was. So we had to pay for private speech and language therapy and then go to tribunal just for speech and language therapy for a young child who had no receptive or expressive language and no means of communication. And I think I felt if I didn't know my son, I couldn't really advocate for him. So everything that I did was to try and help me to understand him, and who he was, so that I could sort of say and understand his needs and then know how best to support him. I think there's also an enormous amount of double standards about the scrutiny we face compared to organisations. So I have had the social worker, looking at my son's bedroom and then running out again of the house. But my son unfortunately had to go into residential care when he was 15. We did hold out as long as we possibly could, but after his school placement broke down, and I tried so hard to make it all work, he did go into a children's home, associated with a residential school. And when he soon arrived there, I arrived one evening and it was cold and there was no heating in the children's home. And, I then got into a whole battle with the children's home, who said, you have to leave, you have to take your son away. I reported it to Ofsted. But I got into a whole battle about servicing boilers, and I was just thinking, I mean, if I in my house didn't have heat, I would have such scrutiny. Whereas it was considered sort of acceptable that there were all these freezing, very disabled children in a children's home, and nobody really sort of cared or saw that was wrong. I did refer to it as child abuse, which didn't go down well, but Ofsted didn't really care either. And I think that's just a reflection of, we are scrutinised so much, and you have to be so careful. And I always felt very afraid as well about what I said or what I didn't say. My son is now in a residential college and therefore in a care home. And one of the issues there is around very significant weight gain. And as much as we have told them 100 million times, he's not capacitous to know what he can or can't eat. I think they've now finally got the message. It's taken about 4 years. So he goes to the canteen and points at all the food, and then he has all the food, and he's gained 5 stone. And you just think, well, if I did that, that would be a really sort of significant bad thing. But nobody really bats an eyelid, even though we've told them 20 million times, including all the services who are involved. I think as well, we've just had unrelenting sort of ignorance, I would say, of the legal structures and legal duties that we're operating in, which puts enormous pressure on us as parents and now deputies to know more about the law than anybody else. So you have to be super prepared you've got to know just everything. And so, for example, my son's funding was stopped when he was in the children's home. And the other issue is they don't tell you anything, because we are sort of not seen as part of a team. And they also say you have no business knowing anything about money. So we found out the funding was stopped because my son was very distressed. And we said, we don't understand why he's so distressed. What's going on? You do have the money, do you? And they said, well, actually, we don't have the money, because the local authority decided unilaterally he wasn't getting the money, and for the support he needs. So we had to go through a whole 3-stage of complaints, ombudsman, and you just think, well, you should never have done that. One of the conclusions and learning we got was that the secret panels should not be so secret anymore, and they should be more transparent and communicate more effectively. But it just felt like something small, because my son, that caused him trauma, and those things are very hard to get over. Also, not understanding the Mental Capacity Act is our latest one. We were ambushed at a meeting in May with a provider and 2 ICB commissioners, And I had to, fortunately, I'd read some of Alex Ruxkeen's work, because I have to understand the Mental Capacity Act. And, I then had to tell them, well, you've no idea what you're talking about, and how dare you, you should be ashamed of yourselves. But, we have to respond to that, and it's incredibly difficult and traumatic, because fundamentally for this group of children, what I know the future holds for my son potentially is avoidable and preventable death, because we know what the statistics are. I know what the statistics are for my son with his health conditions and needs. So I think, I've always felt very scared. I've been subject to parent and mother blame, and I think there's also this talk about the community for our children, but there really isn't a community for our children. Nobody really wants them, and my son has been excluded from church. He hasn't been wanted in museums. There's just so many places nobody really wants him. Sorry, just emotional. So I just wrote here some sort of perspectives from parallel worlds. The system lenses, it's about bureaucracies and inquests and Ofsted inspections and difficult and troublesome families. One of the things that also strikes me is there's no corporate memory. So we're actually the only people who remember everything and have been on that journey. And in our lives, we worry about everyday harm, distress, crises, lost opportunities. We worry about the immediacy of getting help. I want peace of mind. We want pathways to be clear. And, I think that's part of what the problem is. We're looking at entirely different things, and it is parallel worlds. So how do we sort of bring that together? So I think for today, some reflections for me are that we need to understand how family trauma manifests itself through the lived experience and voice of families. So I'm just one voice, all of you and everybody has their own voice and experience. We must address a fundamental lack of respect for families by systems and organisations. We see that every day and experience it all the time. Some families, as we've heard, have been diagnosed with PTSD, some haven't, but they're still suffering trauma. And both situations must be recognised and understood. And I think today, personally, from this first conference about family trauma caused by systems, I hope that we can raise the profile of the need for system and culture change to benefit all families. Thank you.
Thank you, Mary. And I'd just like to extend my personal thanks to Mary as well. Mary's not here today as a representative of NHS England. She's here today as herself. But in her role within NHS England, she was very instrumental in securing the funding for the project that I described earlier on. Now, the report that we produced so long ago, I can't remember how many pages it was, it's considerable, is still sitting on the desk of someone somewhere at NHS England. It's never seen the light of day, and those of you that work with the organisation will know that's not an unusual occurrence. But Mary somehow managed to persuade them to let me publish the journal article. Not only that, but she persuaded them to pay me to do it as well, which was absolutely incredible. So a very persuasive woman, obviously. Thank you, Mary. I'm just going to sort of round up now. So this is the bit that we were asked to do about being, what do we do about it? Quite clearly, we need when family members sort of are traumatized, we do need to be offering support. And but clearly, the answer is to do that. But the most important thing is we need to stop the system causing the trauma in the first place. The system should look a bit like this. And we've already, highlighted, what we've got a very clear vision of where we should be and what the system should look like, and our experiences and experiences of people that have given their testimony today would indicate that clearly that's not the case. That we don't have sort of whole family approaches to working. Families are not given the respect, and not given the support that's required. And when this information came back, when I was analysing it, the things, the numbers, etc., were frightening enough. And then I started reading through the testimony, sort of the lived experience, and I must admit, I thought, well, goodness, this is such a big job. What do we do? And I felt really quite despondent, thinking that the changes that need to be made are so fundamental. We talked about sort of a paradigm shift that needed to take place. And then I thought, well, there are perhaps some easy wins here as well. And this relates to that bit where the system interacts with the family, whole heap of stuff that goes behind that. And this is the message that we would give to professionals, and those professionals that have attended the training that they've referred to all along. So we asked them, sort of when you're in that situation where you're having that narrative in your head, that problem family narrative, and with a group of professionals, I would ask them at this point to put up their hands, and universally, every one of them has said, yeah, I've been there, and I started that thinking. That's the point where you need to hit your pause button. And you need to ask yourself the question, so where is this coming from? Is it in relation to me and what I'm presenting now, or is this about the cumulative experience that this family member has had of people like me that have come and promised stuff and have let them down? And if your next response is, I'm going to make this worse, then don't do that. Do something to make it better. So that highlighting the importance of that pause button. Okay, this is what we've told you today. We were asked by NHS England to look at families' trauma experience. We co-produced a survey, and families told us some very key messages. Is included that the system caused trauma and kept on traumatizing them. Families could identify when and how this happened. NHS England asked us to produce a traditional training resource to raise awareness, and we took no notice of them at all. Indeed, I remember being part of those discussions, and it was based on that and how it felt to me to actually look at a PowerPoint slide versus to have this family member stand in front of me and tell me exactly how it was. And boy, were they different. So this is it had to be personal. Families decided they wanted a different, more powerful resource to tell their story. We need to change the narrative from these are difficult, troublesome families, or these are damaged, traumatized families who need some sort of medical help, some sort of therapy. We still need to be supportive, of course, but we need to address those systemic issues and prevent trauma from occurring in the first place. So significant efforts need to be invested in changing the system. The tendency is always to be reactive, and that was where NHS England were pushing us in the first place. And this is in the interest of all parties. We've already had a discussion. Somebody over there asked, why is it that young adults get pushed into residential care? You know, and I think Luke gave the answer there. It's about avoidance of risk. It's about shifting responsibility to somebody else. And just think about this: if we get this right for young children, if we get the right amount of support for families going in really early, we are going to avoid and reduce this reliance on expensive, inappropriate, poor quality adult residential care. Because there's almost the more money that authorities spend on the placement, the less likely it is to be of significant quality. So there's a real incentive for the system here, but the system's got to start talking to each other. The budgets have got to start to align before it then becomes in its best interest. At the moment, there's perverse incentives to pass actual responsibility and financial responsibility to somebody else within the system. So quite clearly that's got to change. Okay, so these are some of the key actions, but this is what we were asked to do. I told you it was the last slide. So there's a paradigm shift. So we've got to discuss today, this afternoon, how we achieve that. Perhaps the first part of that is identifying, acknowledging and owning the problem. Being the first step. Families and professionals working together and system facilitate and enabling that to happen. Training all professionals so they are aware of this stuff. And we've tried to get in, haven't we? And we've got a meeting, we've had a meeting postponed, but we've rearranged with the Learning Disability Senate. So these are all of the NHS professionals that are involved in delivering services to people with learning disabilities, and they've agreed for us to provide the workshop for them. They've agreed for us to do it free of charge. Yeah, we need to negotiate harder with you. And we also there is this stuff out there about training for parents, and it's always like training you to be a better parent. That appears to be what most of it is about. And maybe we need to be providing training for how do you negotiate the system, how do you become as expert as Mary is in terms of dealing with that? Because I despair when I listen to Mary talk about her experiences, but then I think, well, goodness, if somebody isn't as well informed and articulate as that, they're going to ride roughshod over you. They're going to take you to the cleaners. And then finally, this idea of clear care pathways. These are just some of the ideas, but it is up to you guys. Okay, so these are some of the resources. This is the link to the research article. So we will get this PowerPoint out there so you can have that. This is the link to the broken report. So these are the same thing. So if you just want the information, go to the broken report. If you want to beat people up with it, go to the academic article. This is the link to the YouTube film that is made, and it stars Luke Clements. I was going to come around, Mary and Viv, and I get a tiny part in it as well. And it's professionally made, and I think it's quite good. This is where to go for the Challenging Behaviour workshops. Go to the CBF, Challenging Behaviour Foundation workshops. Go to the CBF, and they will help you and tell you how you can organise that. These are the references that we've referred to in this presentation, and this is the contact for the Challenging Behaviour Foundation and me at the University of Kent. I've got 3 weeks and 1 day left at the University of Kent, and then I'm retiring. but they've given me an honorary post, so I'm around. So it basically means they don't pay me anymore. I still work. Anyway, that's all we had to say. So thank you for listening.